module is going to focus on cost, quality, and access of healthcare. So we'll first start with the cost aspect of healthcare, how we can define it, and a few reasons that attribute to the rising cost of healthcare services. So when we talk about healthcare, there's three main definitions or three main meanings behind cost in healthcare. The first one of those that we can think of is price itself. So when we talk about price, we're thinking about a bill that we as the consumer receive from the physician or the premium that we pay every month for healthcare services. The next meaning behind cost can be healthcare expenditures or spending itself. So when we think about healthcare expenditures, we want to think about the total cost of consuming and producing healthcare services. So this can be things like health insurance, skills that our professionals need to have, so licensures and certifications. We can think about pharmaceuticals themselves and how much we pay for different types of pharmaceutical drugs. Medical equipment that we need to operate, and research and development in general. And the third type of meaning that we can put towards cost in healthcare can be from a physician's perspective. So when we think from a physician's perspective, we think about things like the salary of the staff we have employed in our office setting, the capital that we need to operate our office. So do we have to offer x-rays or CT scans? What kind of capital equipment do we need to be purchasing and maintaining? What things do we need to rent? Are we renting the space for our office itself? Are we renting the equipment? What's our general overhead? And then our supplies that we need to conduct business. Now there's 9 main reasons that we can attribute these increase in expenditures that we see overall, and we're going to talk about each of them individually, but we're going to look at third-party payment, we're going to look at imperfect market, growth in technology, an increase in our elderly population and the demographic shift that we've seen and talked about before, our medical model of healthcare delivery, our multi-payer system and the associated administrative costs that go along with that. We're also going to look at defensive medicine, different aspects of waste and abuse, and different variations in practice. So let's first talk about third-party payment and how that attributes to the increase that we see in cost for healthcare services. So third-party payment, think about your insurance companies. They're that third party that kind of interjects themselves between the consumer and the provider or the healthcare system. Third-party payment is going to end up paying for most of the services that we use. So the payment is not going to come from the consumer, and the consumer is not going to be paying the majority of the share. Now this leads to a term that we've talked about previously called moral hazard. We don't know what the true cost is, so we're more apt to use the service because it doesn't affect us as much as if we were having to pay outright for the service itself. So we tend to sometimes overutilize services in healthcare simply because we don't know what the true cost is, so it doesn't really affect us as it would if we had to pay for that out of our own pocket. The next reason for high costs in healthcare can be attributed to our imperfect market that we have set up. So we have a utilization of healthcare services that is really driven by need because we live in a market-based system, and we have the only market-based healthcare system in the world, and our utilization will cause an increase in healthcare costs overall. Now we also have the quantity of healthcare that's produced in our country is usually higher than what we see in more of our competitive markets. And our prices overall are higher than what the true cost of production is. Technology is growing and advancing every day in the healthcare field, and we can attribute this growth and advancement of technology as having a direct impact on our rising healthcare costs. The expectations of our consumers are also raised because of this advancing technology. Every consumer wants the latest and greatest out there. So the expectations of our consumers are raised about what medical science can do in terms of diagnosis and treatment and overall just prolonging life itself. And when we look at the demographic shift that we're seeing in this country and more of a shift towards our elderly population, recall that we have a lot of baby boomers that are starting to retire. Generally, as people live longer, they're going to have more illnesses, more conditions, more comorbidities that they'll have to deal with. And overall, an elderly population is going to consume healthcare at about 3.5 times the rate of the general population itself. So as we have more of this elderly population retiring, we can start to expect and assume that they are going to start consuming more healthcare services to deal with their various illnesses, their various comorbidities, which will in turn drive up the cost of healthcare. Now, our healthcare system in this country, unfortunately, is very reactive instead of proactive. So when we look at our medical model in which we deliver healthcare services, we're really emphasizing medical intervention instead of medical prevention. So we're de-emphasizing prevention overall instead of emphasizing that, although we are working towards emphasizing prevention, just historically and as of now, we really don't focus on prevention itself. We really are more reactive than we are proactive. Now, if you've ever used healthcare services, you know that the system is very confusing and can be very convoluted. So with our multi-payer system, we do have a lot of administrative costs that go into that. We need somebody to manage the financing, the insurance, the delivery, and the payment functions of healthcare services delivery. And so this multi-payer system administrative cost piece accounts for around 25% of all of our healthcare expenditures. So the more administrative red tape that we have to go through can attribute to the rising costs that we see for healthcare services. Defensive medicine is another aspect that we need to look at and consider. So providers and clinicians overall do take on huge legal risks when they treat patients. So they do tend to practice a little bit more defensive medicine, or some providers do, ordering tests or services that are not really medically justified, but they do that in a defensive way because of the legality and the risks that they take on. So defensive medicine can be another reason that is attributed to high healthcare costs. Now, waste and abuse is unfortunately something that we do see throughout the healthcare system, no matter where you look, but it is a major problem in Medicare and Medicaid with our Medicare and Medicaid patients. So an example of this would be providing services that are either not medically necessary, so think back to defensive medicine, or we are billing for a higher price service than what we need to. The last reason that we'll talk about concerning rising healthcare costs is area variations in practice. So each provider is going to have a different way that they practice, different tests that they have, different standing orders that they have set up. So there's going to be a difference in practice patterns among our providers and our clinicians. And unfortunately, sometimes these do increase costs without having overall better outcomes. So now that we understand a little bit better some of the reasons that we see increasing costs in healthcare, let's talk about a couple of ways that we work to contain those costs. One way we can do that is through cost shifting, or one way that it is done is through cost shifting. And this tends to be problematic for our healthcare system. So when we talk about cost shifting, we're thinking about providers and clinicians working to make up for lost revenues in one area by increasing the utilization or maybe charging for higher prices in other areas that are free of these restrictive controls that they have. Unfortunately, the only way to prevent this is through system-wide controls throughout our healthcare system. And as you know and remember from earlier modules, we have a very decentralized healthcare system. We have no one central location for our healthcare. And so putting these restrictions and controls system-wide could be proven to be a little bit problematic. Now, price controls is probably one of the most important undertaking undertakings that we have in terms of cost containment. So we saw a conversion of hospital reimbursement from our retrospective payment system to a switch to a prospective payment system, or a PPS, around the 1980s. Now this system, this PPS system, was based on something called diagnostic related groups, or DRGs. So we were looking a little bit forward on how much we were going to reimburse for a certain type of minor surgical procedure or a certain type of condition. Unfortunately, overall, this had very little impact on Medicare cost inflation, because while we did see a decrease on the inpatient side in terms of healthcare spending, a lot of that cost was simply shifted to outpatient spending. And our last area of opportunity for improvement in terms of cost containment is working with chronic disease prevention and management. So as of right now, we have about 70% of our healthcare costs that are generated by about 10% of our patients. So go back to one of those reasons that we talked about for rising healthcare costs and our shifting demographic to more of our elderly population. They have more chronic diseases, they are living longer, and with that comes more illnesses, more comorbidities, more chronic disease management. So we really need to work on the improvement and delivery of health care for our patients that have more chronic conditions, steering our system more towards prevention and preventative medicine and a chronic disease-oriented model. So we do this through a couple things like our medical home model, our accountable care organizations, and our EHRs. So just to recap, three primary definitions or meanings that can go into healthcare cost and what healthcare cost means. 9 overall reasons that we focus in on for rising healthcare cost, each influencing the other in one way or another. And then primary reasons why or how we're trying to contain these costs, recognizing that our price controls is one of the most important undertakings that we have done to work towards trying to contain some of the rising healthcare costs that we see overall in our healthcare system and for our patients.